Master Enlisted with the 113th Readiness Emergency Management Flight. Today I'm going to cover the proper wear of the ground crew ensemble, the JS List suit, how to perform drinking from the mask in the canteen, 1574 for the gas mask, how to properly fill that out, and the gas mask fit test. On your helmet, your markings. On your front, you have to have USAF, your rank, your first name and last name. On the back, same thing, USAF, your rank, your first name and last name. On your hood, your front and your back of your hood, that same information. On your left breast pocket, have SIM, IBA. Below that, your first letter of your last name, last four of your social, with your AFSC. On your right side, right breast pocket, will be the same information, USAF, rank, first name, last name. You need your lanyard with your ID card. You need your reflective belt on. Also M9 tape. You need it on 6 places on your body. Your bicep, forearm, and down in between the Velcro on your ankles. Please have your coat cord tied, your belt retention cord snapped, all pockets buttoned and fastened. In addition, you put your combat wallet in your left arm pocket. You put your airman's manual and your player's guide in your right pants pocket. And in your left pants pocket, you put your rubber gloves, cotton inserts, and any personal values. In a contaminated environment, if you're outside during deposition or your M9 tape is showing positive, make sure you decon your M1 cap before you drink from the canteen with your mask. When you mop 4, you need to drink from your canteen. Open up the M1 cap. Your buddy would be with you. You would put 2 fingers on your voice emitter. Your buddy would undo your drinking tube from your mask. Buddy would help you put the drinking tube into your M1 canteen. You would then turn your canteen upside down. Inside your mask, you will grab the drinking straw with your teeth. You can push air through the canteen and get water to your mouth. And the process is reversed to finish. You bring the canteen back down. Your buddy would grab the drinking straw, and then you would put the cap back on top of your canteen. Now we're going to discuss the proper wear and parts of the MCU-2P mask. Okay, right here you have your canister. Right here is your outlet valve cover. With this, attached to this is your drinking straw. Right here is your voice emitter, which projects your voice. This right here is your second skin, which goes around the outside of the mask. This is your lens cover that comes off. This right here is your skull cap head harness. Inside here is your drinking tube. These right here are your nose cup valves. That's it. That's the major components. Okay, this is your QNFT fit test. This tells you when you're wearing your mask that it is within the right parameters for you to be safe in a chemical environment. This is the 1574. It is your serviceable tag for your gas mask. The part number of your mask, your name, what type of mask it is, what size it is. This is your lot number for your MSA. Also your canister number would go here. On the back is your inspection dates. Inspected by is your initials and then the next inspection date. So today it's 5/20/09. That's the date you inspected it. It's not due again for 6 months, except in a wartime situation it's every 7 days. This is where the documents should go in your mask carrier. Your gas mask fit and your 1574.
I'm Staff Sergeant Robert Avery. I'm in the 113th Emergency Management shop. Today we're going to discuss PAR team training, the concept operations, and the proper procedures to conduct a PAR sweep. The first step to conducting a PAR sweep, before you leave the building, thoroughly check the outside of the facility by looking out the window. Look thoroughly before you exit the facility for any damage or UXOs that might be a hazard to yourself or your PAR team member. The first PAR team member takes the first lead. He walks 5 feet from the facility, visually looks around for any PAR or any contamination or UXOs, then physically gestures the next PAR team member over to him. After 5 feet, the first PAR team member walks 25 feet, signals the next PAR team member to follow him behind. Once he gets to the point, he holds the second PAR team member at his or her location. Always keep in mind that 2 PAR team members should never be close to each other at any point during the PAR sweep. If there is a casualty, your unit will send out a self-aid buddy care team to treat the casualty while you continue on your sweep. When the second PAR team member gets to the location, they have the LMR in their hand. They call in what they see.
Code blue 1.
Using the PAR team checklist, call in whatever contamination they have on the sheet. The first PAR team member is waiting, still visually looking for any UXOs or any contamination or damage around the facility. Time is very critical, so if you find a UXO, contamination, or casualty, you call in what you see and you continue to PAR sweep until it's done. If you come upon a UXO, you want to make sure you do the 4 R's. You recognize the UXO, you record it, you retreat, and then you report it. Make sure you're at least 25 feet away from UXO when you're calling it in with a LMR or handheld radio because it can cause explosion.
CC, code white, D1B.
Sweep is done. You enter the contamination control station. You make sure you physically dip your hands in the 5% bleach solution and then rinse it in the water solution. You physically step into the 5% boot trough with the bleach solution, step into the water solution. And then you mark off on a 400 to 48 hour sheet. And then your next step from the water should be inside the facility to avoid any contamination getting to the facility. Transition control points are pre-designated throughout the base. They're used for going into a clean or dirty section. When you come upon a TCP or transition control point, thoroughly read the sign. It'll tell you what sector you're in and what condition you're in, whether you're in alarm black and MOP 4 or MOP 2, and it'll let you know what sector, Alpha, Bravo, Tango, Charlie, Delta, and what you're entering in and what the condition. And it's very important to know what condition you're going into. Before you enter the transition control point, have your buddy physically check all areas of your M9 tape to make sure there's no contamination on your person. And once he's done, you check your buddy to make sure there is no contamination on your buddy. As you get to the TCP table, there is a sign that has the instructions that you follow. Again, if you're going from a dirty section to a clean section, you decontaminate yourself by sticking your hands in the 5% bleach solution, rinsing in the water, step in the 5% bleach solution in a boot trough, step in the water, and then you pat down yourself with a 295 kit. Being careful to make sure you pat down your head and around your mask area. And you make sure you annotate the 400 to 48 sheet. If you do need to refill your canteen, this is the appropriate time to do so.